Hey guys, John here, physiotherapist in Markham. Good to see you guys for another video. Today we want to talk about COVID and how it's impacted physiotherapy. One of the biggest ways that's impacted physiotherapy this year is the amount of virtual stuff that we've been seeing. So today we want to compare virtual versus in-person physio. You'll see in my video, we'll do the pros, we'll do the cons, and you'll see my thoughts at the end, what I think about it and whether or not I would do it as a physio, and if I was a patient, would I do it as well? So guys, stay tuned for the full video. Let me know what you guys think. In addition to that, I just wanted to give a quick shout out to everyone who's been voting for me as Markham's best physiotherapist in York region. Guys, you guys are the bomb. We're still voting until March the 7th. Hopefully you guys can help me out. Vote for me every day if you can on the York region site. It's linked in the description box below. So without further ado, let's get right to our material today. One of the biggest ways that COVID has affected physiotherapists is that it's opened the door to more virtual care. Now, virtual care has always been around. It's been around for decades, since the 1950s for medical doctors, even some for space and NASA, and now we see it increasing in the physiotherapy world because of COVID. So, what are the pros of virtual physiotherapy? Well, one of the very first ones you guys can probably think of is that it is more efficient, right? So sitting in front of a camera talking to a patient, I'm more likely to be able to see more patients and fit more patients per hour. Also, from a patient's point of view, you don't have to travel back and forth, you don't have to drive. In the GTA or in Markham here, we're expected probably about 10 to 20 minutes per drive to and from, which equates to probably about 20 to 40 minutes in total. That's a big chunk of your day you can save, and with all the commuting that we're doing already in the GTA, it's probably a good idea with this efficiency, right? With virtual care, it's also safer, as you can imagine. We don't have to clean in between patients. We don't have to worry about getting things from other people. Think of this, right guys? Back in the day, like last year, we had sick person, sick person, sick person, sick person, all in a doctor's office together. The other pro that I can think of is that physiotherapy online or virtual physiotherapy is likely to be cheaper than traditional physiotherapy. And the reason for this is because you're not getting any of that hands-on stuff that we normally do with you guys. So massage, stretching, education, things like that. So one of the biggest drawbacks with virtual physiotherapy is that we can't perform the clinical exam with our hands, okay? So that means that we have to rely on our assessment and treatment tools that are done just by face-to-face or, verbally, which isn't the greatest all the time, because most of the time when you come into my office, yes, I can probably guess at what you have and what kind of injury you may have or why your neck hurts in certain positions when you're sitting at your desk. But a large piece of that clinical picture also comes from me poking and prodding you and taking you through special tests, clinical tests, watching you move, watching you squat, watching you do functional movements, and putting the big picture all together. So missing that also means that we're missing the hands-on treatment piece that you would get when you're in person with a physiotherapist. For example, things that I do would be manual therapy or working with the hands, okay, stretching, soft tissue releases, okay. Also, we would also do acupuncture, things like that. That can't be done over the camera, just can't be done, right? Think about throwing a needle through there. So guys, what can be done over the camera or over online or virtually? Some of the physiotherapy things that we can still do are super powerful still and still may get you better, which include home exercise program, okay, teaching you how to do certain things and seeing if that will help you with your pain or get rid of it entirely. The other piece that you can get is also patient education. So things that will make you feel better faster and things that you might want to avoid. Some of the tips that I have as a physiotherapist for both physios and patients alike when they're doing a camera or a virtual physiotherapy assessment or treatment. One of the biggest things, as you can see here, is the wireless earbud. So I'll just quickly grab mine right here and just to show you, I use these all the time when I'm doing my virtual physiotherapy, and trust me, it saves me a lot of time. So if I have my earbud in, I can be far away, but you can still hear me very well. and plus it's wireless, so that's a bonus. So we talked a lot about virtual versus in-person physiotherapy. Which one do I think is better? Virtual physiotherapy is not the same as in-person. I would much prefer to be in person if I was a physio or as a patient as well, because the hands-on stuff you're missing out on, the acupuncture, and also the big piece I think you're missing is the assessment piece, is the clinical picture, right? We want to make sure we get that clinical picture right. So guys, that's it for this video. Thank you so much for your support and watching all the way through. Appreciate you guys sharing this video too if you find it interesting. Please let me know in the comments what you think of virtual physiotherapy compared to in-person physiotherapy. Has this opened your eyes? Have you tried one or the other and prefer one or the other? I'd be very interested to know. Until next time, see you later.